In 2015, 54,644 women were diagnosed with uterine cancer. 10,096 women died in 2015 from uterine cancer. Uterine cancer is the fourth most common cancer in women. The most common sign and symptom of uterine cancer is postmenopausal bleeding. Also vaginal discharge, abnormal bleeding between periods, heavy bleeding, pelvic pain or pressure. Do you have any risk factors for uterine cancer? They are older than 50 years of age, obesity, diabetes, not enough physical activity, Lynch syndrome, taking estrogen alone, and infertility.
Hi, my name is Ginger, and I'm 47 years old, and this is my story. I began having a menstrual cycle when I was the age of 12 years old. I didn't know at that time what a normal period should look like, so I've always been heavy. 7 days was the longest when I was a teenager, but as I matured and got married and started having children, it just progressed into a heavier period. Sometimes I would go as high as 14 days. After the birth of my son, I had a tube ligation, and thereafter, the periods just became worse, even more heavier with lots of blood clots. That was horrible. I was bleeding sometimes 20 days, 21 days, sometimes it felt like months. I didn't go to be examined for that because I just assumed that it was normal. When I would go for my yearly exams, I never spoke to the doctor about it because I just automatically assumed that everything was normal. I'd been like this my whole entire life. Just gotten worse as I'd had the tube ligation. I had spoke with friends, talked to other women about this, and they would give me the same story, that their problems began after the tube ligation. So I just assumed that that's what was going on with me. Then I went for an exam when I was 43 years old, and I found out that it was cancer, that it wasn't normal. So after my surgery, I'm fine now and everything is good.